may be thinking about sending chocolates or flowers to the one you love this Valentine's Day, but it's important to also take some time to give a little attention to your heart and also to know your risk factors for heart disease. February is American Heart Month, and this morning we're raising awareness about heart disease. Joining me now in Studio 61 is Theresa Keddy, a family medicine practitioner with ProHealth Physicians, and we are talking about why women specifically are often misdiagnosed and the signs that we as women really need to be aware of. Thanks for being with us today.
Absolutely. Thanks for inviting me.
Now, a lot of us here are wearing red. It's Go Red for Women Day because women specifically tend to put off warning signs because we're so busy, and we really can't do that. We have to put our health at the forefront because we're responsible for so much.
Absolutely. It is very important to make sure that we're being proactive about this. So you don't want to wait till you have those signs occurring. So that's why it's very important you see your primary care doctor regularly and you get screened for these other conditions. So checking for high blood pressure, checking if you have high cholesterol. These are the things that eventually may lead to a serious heart condition and that you really should be paying attention to prior to an event occurring.
And we do know that women oftentimes are misdiagnosed. Why is that?
The symptoms can present a little differently. So when you think about heart disease, you think about someone, having chest pain and pressure and clutching their chest. However, sometimes with women, you can have dizziness or nausea or just kind of feeling unwell. And so it's really important to listen when you can tell something's not right with your body and get screened early.
So what are the warning signs that we should really be taking note of as far as for heart disease?
So,
because they are harder to spot. It's not that sort of clutching your
Exactly.
chest.
So sometimes because the symptoms can be so difficult to find, that's why we usually say try to look at the other side of things, the numbers. So your cholesterol, your blood pressure, maybe are you at risk for diabetes? Because these things, which your doctor can easily find through blood work and routine examination and your vitals, those things, then you can try to assess those sooner rather than later. As far as the physical symptoms, again, they might go unnoticed or you might attribute them to something else. And so that's why it would be very important to kind of get the data points that might help.
I have to imagine when you get diagnosis, you're thinking heart disease, what, me? What are the treatments that are available right now?
So there's a lot of different treatments. It depends on the severity and what type of heart disease, because there are different kinds of heart disease. And we are lucky that we have a lot of great interventionalists and everything at the hospitals around here. However, what it all comes back to, again, is the prevention part. So if you can stop smoking, if you can try to have a heart-healthy diet, if you can try to control those other blood pressure, diabetes conditions, this is where, the work comes in to prevent those other things from happening, because you can always catch something and do something about it later, but sometimes there's reversible damage, or you're dealing with a lot more at that when you could take the initiative now and deal with the preventative part of it.
Right, and speaking of the preventative part, the best thing to do is to get your regular checkups, and I know sometimes it's just so hard to fill it in, fit it in. Women, we're moms, we're busy, we're working too. Yeah. So it's something, just another reminder to make sure you schedule that, whether it's like, maybe Valentine's Day is your time to schedule, or the New Year, make your list of doctor's appointments to
so many people put it on the back burner, like you're saying, and
it gets moved to the bottom of the list with so many other things.
But if you have a heart event or something, that gets moved to the top of the list, right?
Absolutely,
so it's time to do the work early, and then
and it's also not just doing it for yourself, it's doing it for your loved ones, because goodness, if something happened to us.
Absolutely, absolutely.
All right, well, thanks so much for being with us. We do appreciate it.
You're very welcome.
Really important reminders, as always.
Absolutely.
And for folks at home, if you're getting ready, get dressed still, put some red on. Go Red for Women, right?
There you go.